Under the ladies' reproductive health, we're going to talk about family planning. Family planning majorly is a way of creating, it's a birth control methods whereby you create space in between childbirth so that you can prepare yourself. One, it gives you time to know when to deliver or to have a baby, and when to take care of the baby and how to grow the baby. With this, you create time for your own self. Like you might say that I want 5 children and when to deliver them. Is it I want those 5 children at once, or I will be giving birth every after 2 or 3 months, so that it gives me time to prepare myself and also to collect money to look after other one. So in simplicity, family planning is a plan for your own birth of your children or giving delivery, or it is a birth control method. So with family planning, when you to practice family planning, there are different types of family planning. Now what we wanted to know, the advantages of family planning. Advantages of family planning: 1, it gives you to understand the number of children you want or babies that you want. If you say that I want 5 children, it will not be able for you to produce 7 or to deliver below or 3. You will time yourself to know that I want this and this. 2, it gives you proper planning, that you plan for your child, that now because I don't have money, let me plan that I will have these children and I will be able to take them to these schools. Because remember, if you produce 10 children according to your income, you will not be able to take them to good schools. But if you have 3 children, you will be able to take them to a desired schools that you want, as family planning you have planned for. And 2, it gives you also space to plan for your own development or projects that you have. Because remember, by giving birth, you'll have to take control of the children to pay school fees. But also you, as you are a person, you have to save for your own development. You have to build, you have to buy a plot, you have to feed them at home, you have to take medical bills as you, a person, as a mother or as a father. So with that is the good about it. The disadvantages, I will say that we have minor disadvantages, but the disadvantages also depends on the types of the family plannings that you use. And what are the types of people to use family planning? I will say that family planning is used to only those people who are giving birth. Because 1, if you don't give birth, you have the infertility problems, I don't recommend family planning to you. 2, if you don't have a uterus, when you ever had what we call hysterectomy surgery, I don't recommend family planning to you. You are in your menopause, when you no longer get pregnant or you no longer deliver, I don't recommend family planning to you. So family planning is only used to those people who are still giving birth and they want to plan for themselves. So we are going to talk about the types of family planning. We have what we call condoms, the use of condoms, whereby you get your condoms, you have both the male condom and the female condom, and then you put it on, you keep using it day to day, that one. And then when you say that you want to have pregnancy, and then you go for a live sex, that one is a first method. 2, we have what we call the oral contraceptives, the pills, whereby you swallow the pills. We have those pills that are for mothers who are giving, who are breastfeeding, the breastfeeding mothers. And also we have pills that are for mothers who are not breastfeeding, the COCs and then the POCs. So it depends on what you are supposed. So if you are to use the pills, I would recommend you go to a family center, a health center with reproductive health programs, and then you inquire. They will advise you, because there are some oral contraceptive or pills that have side effects. Which side effects? They affect the milk production, the breastfeeding mothers. You will take them and then you will end up saying that I don't have milk. They dry up the milk. So with that, you have to be keen, because on those pills we have the estrogen pills and then the proestrogen pills. They work differently. So it depends on how you use them and under what conditions you use them. And also, if your husband is not there at times, when like these people take sometimes when they are not at home, 3 months, 4 months, 6 months. So there we advise you stop the use of those pills. But when you know that is about to come, in that month, you start using it accordingly or as per the advice of the. And other side effects of those pills, they tend to cause heavy bleeding. They tend to make people lose weight. They tend to bring that heavy dark bleeding, and also in some cases we have received or registered complaint of fibroid or cysts. But the pills are for monthly. Of recent, also there is some pills that was registered out, what we call the China pill of a month. You take one pill for the whole month. But also it has a side effect of headache, dizziness, nausea, so forth. But it is under the oral contraceptive, or what we call the swallowed tablets. We have the one taken by mothers who are pregnant, and also we have those mothers, the lactating or the breastfeeding mothers, and also we have those pills that are taken with mothers who are not breastfeeding, and also we have one tablet that can work for the whole month. Most people refer to it as a China pill because it was made from China. So the second type of family planning is what we call an injector plan. Injector plan, we have two types of injections. We have what we call cyanopress and the Propovela injection. Those two, the Propovela injection is given intramuscular into the muscle. Mostly they tend to give it on the shoulder, and when they give it to you, the way how it works, it goes into the body. It is an hormonal drugs that when you take, it affects the hormone. The hormones that stimulate the production of the ovaries or the ovum in the body, so that, and then you can spend 3 months not bleeding. That's why in most cases that when you receive those injections, you will spend 3 months not bleeding. Reason being that those hormones are stopped or affected, and you will not get your periods, or the eggs will not be, and then you will be having sex. It kills the hormones that facilitates the production of the ovum, and then you find that that bleeding or anything will not be there. It's being contained for 3 months. Most cases, those injector plans and the cyanopress or the Propovela method. So the pills are for monthly, but for the injections are for 3 months. And we have only 2 types, and those are the cyanopress and the Propovela. And the side effects I've told you, you lose weight, or at times for some other people, according to their blood or what, it tends to cause them to eat a lot, hence they grow weight. And also we have what we call headache, dizziness, and at the end of it you tend to get heavy bleeding with some clots in it, and also other registered battle, the fibroids, and also the myomas, the cysts in the uterus. The third method we have what we call the implanon and the jadela. Implanon is a 3-month method whereby they get a capsule, they insert it under the skin, subcutaneous, and when they insert it into the skin, that capsule will affect the body or the hormones. By affecting the hormones, it kills the ovaries, and then you find that you're not getting pregnant. So with this, it takes you 3 years. The implanon takes 3 years. The jadela is a method that takes 5 years. Jadela and the implanon, they work in the same way by affecting the hormones, and you don't get the pregnancy. But you remain in your period. You remain getting your periods normally. But to some people, they tend to take time without getting periods, and then if they are to get period, they can get it like every after 3 months or every certain period, but you find that that pregnancy is so heavy. The side effects of jadela and the implanon at times are heavy bleeding or severe bleeding. And if you get that bleeding, I recommend people to go back to the centers got that family planning method so that they can revise, and or they give you medication. And they tend to create loss of weight. You find a pattern growing thin because of it, and some people, others, when it has appreciated, find people growing fat. The 5th method is what we call IUD, Intrauterine Device. We get a certain device, we insert it through the vagina into the cervix, the uterine cervix. It is a copper coiled device. That copper coiled device, it kills semen, and sperms majorly. It is an non-hormonal method. And if I'm to recommend, it's one of the methods that I would recommend to the ladies. One, that intrauterine device, it is non-hormonous. It doesn't affect the hormone, and even it has no way how it affects the ovum or anything in the uterus. And it only weakens a man's sperm that will pass through to go and make a woman pregnant. But it has no side effect, unless the only side effect is having multiple partners or having sex with different people. One, if you keep on having sex with different people, that copper coiled device tends to be affected. How? The semen of men or a male semen, they differ in acidity and other factors. So if you tend to have different men, in some way it's affected. So in most patterns, the IUD is recommended to mostly what we call faithful partner, when you know that a woman is, or a lady is to have sex with one partner. And also manhood size changes. To avoid its misplacement, we recommend that it is ever advisable to have one sex partner. And also, we tend to advise people to avoid having or getting these infections, the urinary tract infection or STDs. So that's why we discourage multiple partners. But it's one of the best methods, and it is, I can say, a longest family planning method of about 7 years. It can even take a certain, the moment you feel that you're tired of it is when you can remove it. But it has no complication, and we've registered a few of such. Other family planning methods we have tube ligation, or whereby we cut the fallopian tubes, or we remove the uterus. Then you know that you will never deliver. After delivering the total number of children you want, they just remove the uterus, or they block the fallopian tubes. And also same applies to men. If you feel that you don't want to deliver more, we can go and then we just, those testosterone ducts, they cut them and then they block them. That means you will not be able to give birth. So it is advisable. Those are the family planning methods that are common with us, and they can. But the complication with them is, one, the major in general: headache, dizziness, heavy bleeding, loss of weight, at a time weight gain, and you have fibroids, uterine such stuff. And at times, in most cases, if you use it regularly or for a long period of time, you can, for the first time of pregnancy, you can end up getting what we call blighted ovum. But it comes for a certain period, then later on you get your pregnancy. With family planning, most people have a propaganda that there is some blood test that they normally do, and then they see any family planning that suits with the body or what. But our advice, one, is if you to do, or if you to get any family planning method, first go to the health center where the service is being given, and then you inquire. You get what we call counseling well. 2, according to your sex timetable or sex practice timetable, because we will not recommend you to have a jadela or an implant when you know that you have an away husband. Your husband has gone abroad for a job, or to work, or to do anything for a certain period of time, like 3 years. Why do you have to put an implant on? No, you can abstain. It is a good method. So unless when you know that you have, your husband is available. So the reason as to why we tell you that you go to the facility is to talk to the medical personnel to get you a better method. But in a real sense, we don't have any blood test for a family planning. No. We don't have any test that is being carried out to see that family planning suits you. No. But we keep on telling you that if you take this, the side effects, outcomes, the desired, this and this, and also the family planning that you want, we give it to you according to the time, the time space that you want in between. You might say that I want to deliver after 4 years. Automatically, we will recommend you the family planning method that falls into that space. You might say that I want 2 children in 5 years. Also, we will tell you that the best one is jadela, or it is an intrauterine device. Or we can say you're a breastfeeding mother, but I don't want to get pregnant. Automatically, we'll have to recommend pills that will be able, but there is no blood test that is done when you're going to do, unless when they are going to do this HIV test, because this family planning, also they are affected by those diseases. Also they are affected by our behaviors like smoking, alcohol drinking, the kind of jobs. Prostitutes, we cannot recommend them IUDs, no. At least we can recommend them condoms and what. That's why we advise you that before getting any family planning type, it is better you go for a medical checkup, and then offer a medical advice and counseling from the family planning agents. Yes, but there is no blood testing for any family planning method. This propaganda that family planning can lead to infertility it is no. Family planning can never lead to infertility, but only what I normally tell people, that the kind of family planning according to your body and the way how you behave is, it has an effect. You can delay to conceive, but you cannot fail to conceive unless when you are, because you might say that I wanted to use Jadela for 5 years, and then you reach at a certain extent or with certain time, then you said that no, according to how I've estimated, I'd put Jadela for 5 years, but I've reached 3 years, I don't want to go for 5 years, let me remove. But the effect of Jadela might remain into your body, and you might not conceive there and there immediately, because Jadela, it is an hormonal. So being an hormonal method or plan, it will affect the hormone for a certain period. It can be something like 6 months or a year. But after, when your body has cleansed and it is fully recovered, when it is okay, you will get pregnant. But there is no family planning method that leads to infertility. No. Health is wealth.